Hello and welcome to Pregnancy Info. Today we are going to discuss the tips for labor. Here is a list of tips to help expectant parents have a positive experience during labor and delivery. This fact sheet focuses on the three phases of Stage 1, latent, active, and transition, and Stage 2. For more information about each stage, check this video till the end. Stage 1, the latent phase. This is the first phase of Stage 1. It begins when contractions become more regular and ends when the cervix is 3 cm dilated. These initial contractions are generally mild. Tips for the mother. Finish packing your overnight bags. Make any necessary phone calls, etc. If you go into labor at night and don't feel much discomfort, try to sleep or rest before your contractions intensify. If labor begins during the day, try to rest between contractions. To keep up your energy, eat small snacks that are easy to digest. Drink fluids, water, fruit juice, popsicles, etc. at regular intervals. Walk to reduce your discomfort, stimulate labor, and take your mind off the pain contractions. To ease the pain, you can also take a warm shower or bath, get a massage, rock back and forth, or practice rhythmic breathing. Stage 1, the active phase. During the second phase of Stage 1, the cervix dilates from 3 cm to 7 cm. The contractions become more longer, more frequent, and more painful. Tips for the mother. Change position regularly to reduce discomfort and help labor progress. Try to hold the same position for at least 2 contractions to give yourself time to adjust. If you are still uncomfortable, try another position. Choose positions that accentuate the effect of gravity to help the baby move down the birth canal. Stand while leaning against your partner. Sit down, lean forward while holding on to a chair, or kneel on all fours. Squat or sit on a toilet seat to open up your pelvis. Lying on your back is not recommended during labor, but if you find it comfortable, place a pillow under your right hip to clear the inferior vena cava and allow better blood flow to the baby. Urinate often. It is necessary to empty your bladder for giving more space to your fetus. Drink small amounts. This is good for making the home for a baby. Get a massage or have heat or cold applied to painful areas. Find a good breathing rhythm that can help you to ease your pain. Rest between contractions. Visualize your baby. Take a warm bath or shower to help you cope with the pain and relax. When the baby's head is engaged and the membranes are ruptured, it may be possible to take a therapeutic bath. The hospital staff will explain the procedure to you. Stage 1, the transition phase. During the final phase of Stage 1, the cervix dilates to 10 cm, which is the diameter needed for the baby's head to pass through the birth canal. This is the shortest but most difficult phase. Tips for the mother. Get into comfortable position and find a good breathing rhythm. Try to focus on one contraction at a time. Try to close your eyes and breathe regularly between contractions. Stage 2, delivery. This stage begins when the cervix is fully dilated. It ends when the baby is born, depending on your situation, your preferences, and the recommendations of care team. You may decide to start pushing as soon as you feel the urge, or instead wait for the contractions to begin the baby down into the pelvis to limit active pushing. Tip for the mother. Notify your doctor or midwife when you feel the urge to push. If you don't feel an urge, your care team will let you know when it's time to start pushing. An effective push provides maximum oxygen to both the mother and baby and allows the perineum to stretch gradually. Depending on your position, listen to the advice of your nurse or healthcare provider or midwife. Relax the pelvic floor muscles. Unless you are told that the baby needs to come out quickly, push the baby down gradually, giving 3 to 5 small pushes with each contraction. This method gives your vaginal tissues time to stretch and reduce the risk of tear. It's also less demanding on the baby. Focus on pushing your baby down. Imagine you are giving giving them as much space as possible. Visualizing can help encourage your baby's smooth descent. Try not to hold your breath during a push. You shouldn't stop breathing for more than 5 seconds. When you push, exhale slowly as if you are slowly emptying a balloon of air. This technique has less harmful effect on the perineum. Often it can be helpful to grunt after each push. Grunting is an effective method because it lowers the diaphragm, which then exerts pressure on the uterus. This type of natural vocalization should be encouraged, unlike shouting, which expands energy and prevents you from pushing. Your care team will update you on your baby's descent as you push. Between contractions, let them know how you are feeling. They will also keep you informed and ensure that any interventions and adapt to your needs. Rest and relax between contractions. Things to keep in mind: rest between contractions, change positions to relieve the pain, and coax the babies down. Follow the care team's instructions when it's time to push, and pray all the time. And remember the God in this pregnancy journey. This is all about the labor and its tips. Share this video with the females who are going under the labor process and want to deliver the baby. Be back. Thank you. Take care. Bye bye.